Hi, I'm Rachel Polito. I'm a physical therapist here at PTS in Dyersville. And today we're going to talk about the abdominal muscles. Also, we'll talk a little bit about your core muscles and what role that plays in your health, and especially with regard to back pain. So the analogy that I'm going to use to tell you a little bit about your core is with this pop can here. So if you think about the pop can, if it was full and closed, you wouldn't be able to crush it. But when you pop the top and it's empty, you can squeeze it and crush it. So if you think about it, this is kind of like our core. So the top of the pop can is your diaphragm muscle, which helps us breathe. The bottom of the pop can is our pelvic floor muscles. The front is your abdominals, especially your deep abdominals. And then the back is going to be your deep back muscles. So if one of those pieces isn't working the right way, it's kind of like once you open the top, you can crush it. It's a weaker system than when all four parts are working well together. So let's talk a little bit about the anatomy of our abdominals. So this is the top layer of your abdominal muscles. So this muscle right here on both sides is called your rectus abdominis. That's the one that we all think of when we think of a six-pack. Really, that muscle doesn't do a whole lot for the stability of our spine. People just like to exercise that muscle so that their abs look good. But in terms of back health, it's not really the most important muscle. And then along with this layer, you also have right along here on either side, that's called your external oblique. If we go in one layer deeper, you can see underneath of that on either side is your internal oblique. And then if we go one layer deeper, your deepest abdominal muscle is this muscle running along either side called your transverse abdominis. And this is the muscle that really plays a role with stabilizing your spine and giving you good back health. Because if you look at it, it kind of looks like a back brace or like a corset. And that's basically what its function is it gives our back a lot of stability, and it gives us a lot of core strength when we're doing things like lifting and bending and reaching and twisting. All of those abdominal muscles plus the core muscles, like we talked about with our pop can analogy, have to all work together when we're doing different activities. So one of the main roles that our core plays is before we go to do something. So like before I go to reach up to the shelf, my core muscles actually turn on and engage, and that's what protects my back. In people who don't have that working as well, that's usually what leads to hurting your back or having a back injury. So there's not really one size fits all in terms of how to strengthen your core muscles. And a lot of people think that sit-ups are the way to go in terms of doing core exercise, but that's probably the last thing that you want to do. If you have any questions about what you should be doing for your core, if you have some back issues and you feel like your core muscles are weak, that's where physical therapy can definitely help. So feel free to give us a call in Dyersville or Manchester, and you can also look at our website where there's some more information on our body diagram about back pain and our core muscles that you can read about there. And thanks for watching.